Good evening and welcome to our COVID-19 update. I'm Ladi Akeredoluale. Here are the highlights at this hour. Unity schools resume in some states of the Federation. Adherence to COVID-19 protocols substantially high. Federal government to decide on next level of COVID-19 response as only Abuja and Lagos meet testing targets. And British Prime Minister Boris Johnson rules out second national lockdown in the UK. We start off in Abuja, where the Presidential Task Force on COVID-19 today resumed its twice-weekly briefing. And the chairman of the task force re-emphasized the need for Nigerians to continue to comply with all safety protocols. Mr. Mustafa explained that Nigerians will soon have a brief on the next phase of the pandemic response.
Before this week runs out, the Presidential Task Force shall unveil to Nigerians the next steps regarding the remaining phase of the eased lockdown. As you were informed last week, findings and recommendations have been compiled and will be presented to Mr. President in the 8th interim report shortly. The debate about safe reopening of schools has dominated the space of conversation by concerned citizens and parents. We wish to reiterate that the federating units have the responsibility for determining the dates and modalities for the safe reopening, while the federal government continues to provide guidelines. The Presidential Task Force and relevant MDS have made appreciable progress in the discussions with the European Union over flight restrictions and entry of Nigerian nationals and holders of long-term Schengen visas into the territory. We are making appreciable progress, and we hope to make a favorable announcement on this very, very soon. Before I round up, let me, as always, remind all Nigerians that together we must continue to take responsibility and remain vigilant and extremely careful, looking at the global picture with resurgence of COVID-19 in countries that we thought had flattened the curve and dampened the spread, now having to deal with even issues of specific and selective restrictions being imposed in those countries. So we cannot announce that we are out of the woods yet.
Meanwhile, the Director General of the Nigeria Center for Disease Control, the NCDC, Dr. Chikwe Ihekwazu, says the safe reopening of schools across the country is a priority of the federal government. Dr. Ihekwazu said that after consultations with stakeholders, guidelines have been developed on compliance to all safety protocols.
The virus behaves differently from most other viruses that we know, where transmission has always been primarily driven by children. But now we're better informed and continue to adapt our guidelines as new knowledge emerges. Drawing from what we now know in our context and in our country, with our experiences to date, we have worked with the Federal Ministry of Education to develop new guidance for the safe reopening of schools across the country. We have put this in a very simple format, so every school can pick this up across the country and adapt it to its own uses. We've done this very carefully, recognizing that the resources, opportunities of schools differ around the country, but really focusing on the principles of what needs to be done. Some schools will get there earlier, others will get there a little bit later, but the key thing is that we are all moving in the direction of safe reopening of our schools. These guidelines include strong recommendations around regular risk assessments, sharing updates of the medical students of medical status of every student, a clear communication plan, so that when there's an outbreak or when there's a cluster of cases, schools know exactly what to do, who to inform, how to respond. Advice on designated hand washing areas, triage of patients, sample collection, all these critical questions that every school in Nigeria will be asking. How are we going to do this? The more detailed guidelines are in the detailed guidelines on school reopening that are on our website, but this really gives, in 2 pages, some simple guides to everyone to use.
And the national coordinator of the Presidential Task Force on COVID-19, Dr. Sania Liu, says that states of the Federation should put in more efforts in testing their citizens. Dr. Liu explains that only the Federal Capital Territory, Abuja, and Lagos State have complied with the national targets of testing 1% of their population's capacity.
With the reopening of schools, the PTF remains concerned about the long-term impact of COVID-19 on education and eventually our economy. As of today, we are approaching about 600,000 Nigerians having tested for COVID-19. This might sound like a huge figure, but it's actually quite low. Our target is for every state to test at least 1% of its population. Only the FCT has achieved this target. Lagos is fast approaching with about 97% achievement. But other states are barely above 20-25%. So what it means is that most of us do not actually know our status. And this becomes even more important as we continue to relax our restrictions. We know coronaviruses spread silently and they spread quickly, which is why we must follow safety measures at all times, especially in our schools. As mentioned by DG and CDC, both the NCDC, the Federal Ministry of Education, PTF, and state authorities have been working very closely to make sure that the guidelines we produce are relevant to our setting and will also enable us to continue on the right track of keeping on top of the pandemic.
Health Minister Dr. Osagie Ehanire is optimistic that ongoing collaboration between Nigeria and other countries will soon result in the production of vaccines for COVID-19. The minister was speaking today in his office during a meeting with the leadership of the Association of Hospitals and Administrative Pharmacists of Nigeria. He says Nigeria cannot afford to sit on the fence on the issue of COVID-19 vaccines.
Our researchers are also doing their own towards learning more about producing vaccines, and NAFDAC is hard. We also have to get the necessary pre-qualification for us, which they are working on. But we are with the World Health Organization group that is working to secure vaccines for lower and low middle income countries where we are well represented, and also talking to other countries who are working on the same program to see who is successful in developing and can either share the vaccine with us or share the technology with us. We have spoken with various other countries and received options of offers of cooperation, and we are not throwing anything away, any opportunity away. With regard to the testing, the modality is being worked out. We have to select how to go about it, and we're working on that. Immediately the modality is worked out, then the 1-week surge testing will be conducted so that it covers a representative area of the country, and we can have a result that we're happy with and that the international community will also understand and support.
Moving on to the actual reopening of schools. Now, the Federal Government College in Enugu has resumed school activities after 6 months of lockdown occasioned by the COVID-19 pandemic today. Both the principal and students, who are excited to be back, said the resumption is apt to enable them make up for the time schools were not in session. According to the school's principal, Mr. Raji Adiwale, the school has provided all that is needed for strict adherence to the NCDC guidelines for the safety of all students in schools.
We have put in place all COVID-19 guidelines for resumption. Starting from the gates, we have sanitizer, hand washing machine, we have soaps at various spots. When you were coming into the office, you saw one downstairs. We are by the hostels. We are at the entrance to the hall, at the clinic, in front of all classroom blocks. Each student came in with 5 face masks, and since we were moving around, you can see them using it. So no face mask, no entrance. So the school is quite prepared for student resumption.
I was praying to come back, and thank God I'm back. And we are going to keep complying with the rules to keep ourselves safe from the disease.
All other classes in both private and public schools in Lagos State have been asked to resume next week. That's Monday, the 19th of October. This announcement was made by the State Commissioner for Education, Folashade Adefisayo. According to her, the physical resumption, which is for the 2020-21 academic session, will now include pupils in pre-primary like daycare, kindergarten, and nursery schools. She says this decision was taken after careful deliberations and consultations with relevant stakeholders, including safety professionals and nursery school providers, school owners, and managers of all private schools, who are to ensure that they are cleared by the Office of Education Quality Assurance before physical resumption. The Commissioner also says all public and private schools are strongly advised to put safety first by adhering to the COVID-19 safety protocols, and that the Office of Education Quality Assurance will continue to monitor and evaluate schools' preparedness. In Edo State, the federal government Girls College in Benin City, its capital, has reopened as well for the third term, adapting to the new normal in schools as related to compliance with the COVID-19 protocols for the prevention of COVID-19. The school has set up a temporary isolation center in addition to the existing sick bay, reduced the number of students in its classrooms and exam halls, dining area, and hostels. The school is said to have about 2,000 students, but those in junior secondary school class 3 are done with their exams for the session and have left the school, creating more room for those who are returning.
One of the nurses at the Federal Government Girls College, Benin City, the Edo State capital, handles the temperature check for visitors at the school's entrance as the third term begins in the school. Provision for hand washing has also been made here and at other points within the school's premises. Online teaching is said to have been on during the COVID-19 break, with teachers utilizing this computer room and others to reach their students at home.
The online class was actually very effective. Like the teachers and everything was running smoothly. Since we resumed yesterday, the principal has made sure that each student is checked before entering into the school, and also each student must have their hand sanitizer. She has made sure that we are using our face mask, and I'm so grateful to her for that.
The school had a health center prior to the pandemic, which is still running. The school's management says in preparation for the exit examination in August, this COVID-19 isolation center was set up.
We have been maintaining social distance, and this we have made the students to comply with. If you go around the classes, you can see that the children, they are complying, and God is helping us. And we have infrared thermometer that we use in checking the temperature of the students. And if we observe anything that we are not comfortable with, we send them to the clinic, and there may be referral to the temporary isolation center created by the college management.
With the students back to school, the classrooms are said to have been redesigned to take fewer students in order to maintain physical distancing. This arrangement is replicated in the dining hall and examination halls. The hostel is another area adjustments are said to have been made.
All the boreholes, we make sure they are working well so that there will be no water problem. And we procure hand washing facilities. So in all the classrooms, we have hand washing facilities. We make sure that the classes are not congested, they are well spaced. Also the hostels are well spaced so that we can we make sure that the students are learning in very safe environment.
The authorities maintain that they are determined to keep the students safe and would ensure daily temperature checks for students, staff and visitors, hand washing and other guidelines are followed strictly. Available space for physical distancing they maintain would also increase when the SS3 students end the examination in November. Jessica Olubese, Channels Television News.
From Edo in the south-south to Imo in the southeast, where our correspondent, Tokwe Kutei, has the very latest on the resumption of schools there.
After 8 months of closure due to the COVID-19 pandemic, schools in Imo State have now reopened following state government's announcement of the resumption date. The state government, through the Ministry of Health and COVID-19 Task Force, rolled out some guidelines and protocols for schools to observe as they resume. Earlier today, we went round Owerri, the Imo State capital, to monitor the level of compliance of schools to the COVID-19 pandemic, both primary and secondary schools. While some schools are taking this protocol seriously, some are still finding it hard to grapple with this new normal.
Initially, we are thinking that it will be everybody until we heard the commissioner make an announcement that only the junior classes will be in school Mondays and Tuesdays. So even the senior classes that eventually came to school with assignments, we had to send them back in order to comply to the government's regulations for now.
I want to tell the parents not to be scared because we are ready. We will make sure any child that comes in here will be protected because we're going to make provisions for them, at least for the washing of the hands and cleaning the environment. It's for them. I just want to tell the parents to make sure they provide this the first mask for the children.
Some students say they are happy to be back to school after a long period of time.
I feel wonderful. I'm so happy that we let her resume school after all the lockdown. I'm so happy.
Meanwhile, the chairman of the COVID-19 task force in Imo State, Professor Morisiwu, said the government has put all modalities in place in case of any eventuality, and the state government is adhering strictly to the NCDC and UNESCO guidelines on school resumption.
We had actually, when there was the opening of school for the exit classes, we had laid out a very comprehensive plan, and we were actually following the UNESCO guideline. UNESCO has a very clear plan, which actually consists of three main components. One is the planning itself. The planning has to take care of finances, take care of human resources, has to take care of the logistics. So we did have an elaborate plan, but we are dealing with children, and that particular age, the secondary school, is actually the age of people who are by nature not supposed to, they don't normally obey laws. So we have to really have very careful guidelines how they should follow.
And that's it for now. Tokwe Kutei for COVID-19 update.
Let's return to the south region and to Delta State, where in Asaba the schools have also reopened.
Our pre-resumption preparation started with getting the teachers aware. We have had workshop and seminars and training for the training of the teachers on compliance with the COVID-19 protocol. And we had, in addition to that, before the students actually left, we had sessions with them before they closed abruptly. And then while at home, lectures were taken online. And the process of taking the lectures online, we also pass some of this information to them.
Shaking hands, hugging, we will not be doing it for now. Yes, but we see each other, we wave at each other. We gist, but it will be social distancing.
Enter the class, we wash our hands. Then as we enter, we sanitize. Then if we go out for break, we also wash our hands before entering again, then sanitize. And also put on face masks and observe social distancing.
The reopening of Federal Government College, Ibusa in Delta State. Let's take a break. When we come back, we'll tell you a little bit more about the reopening of other schools today across the country. And then, of course, we'll take the medical perspective on all of this. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. As we promised before the break, we're still talking about resumption of schools. And in the Federal Capital Territory, Abuja, they have also started the 2020-2021 academic calendar today. Ahead of the reopening, the schools were decontaminated while students were subjected to COVID-19 protocols upon arrival in the school premises, including the wearing of face masks.
Students in the nation's capital are back in school 7 months after the COVID-19 pandemic forced them to stay at home.
Hello, how are you? Welcome to school. Hello, how are you?
Upon resumption, the students are subjected to health checks in line with COVID-19 protocols.
We have the hand sanitizer available, the washing base available, and every other thing put in place. Now, the junior one that are just coming in, the GS1 and 2, we are to ensure that not each class should not be more than 25, and we make sure that we abide by the law.
The schools have been rearranged to accommodate the guidelines for school resumption in the classrooms, while students are expected to use face masks while in the school premises.
There is no contact in the class. We maintain social distancing, and even at the playground, we've made arrangements for only one class to play at a time, and that's with less than 10 children on ground. So, and the teachers are all there, all hands are on deck to ensure that there is no contact.
That there should be social distancing even in the bus as we have in the classes. So in the bus, the children will be spaced, and they've been trained, they've been sensitized, so they know what to do well in the bus. They'll still have their nose masks on, they'll maintain social distance, and we keep on fumigating, decontaminating our buses, ensuring that it's safe enough for our children to use. So I don't think there's a problem. Our parents have given their consent, and some of them that can, that are part of the program are already aware and they have agreed.
Some of the schools have health personnel and facility on ground, and they are appealing to parents to ensure that their children comply with the protocols on their way to school.
From the FCT to River State, where the Unity School there too resumed today.
As a federal school, we are closely monitored and given directives at every point. We were given directives to put things in place, wash hands, positions like this, all over the classroom in dormitory. Then we were to do social distancing. We have an isolation center. Then we have the clinic. Then if any student shows any symptom, we are directed to call the parents immediately.
The 7 months at home has been slightly hectic, if I should say. And coming back to school is good. Get the blood pumping on learning again, and we can focus on our studies better. So being at home, lazing around, doing nothing, it's actually great to get back to school.
I wash my hands a lot. I wash my hands. I observe social distancing anywhere I find myself. Then I always go out with my face masks and hand sanitizers.
All right, let's talk to Dr. Alero Roberts, consultant public health physician who joins us from the Koyi area of Lagos via Skype. Good evening, Dr. Roberts. Nice to see you as always.
Good evening, ladies. Nice to be here again.
Last week at this time when we talked about this, it was theoretical, and at that time you expressed confidence that it would go well. Now that you've seen the actual reopening in some of the schools, has that confidence been borne out, do you think?
Oh, absolutely. And I'm so happy to know that the students are back in school and back on a learning trajectory. because it's far more important for the youth to be in school, to be educated, to get to achieve their full potential as far as they can. Out of school, they are prone to far more danger than the coronavirus. They are prone to all kinds of exploitation, harassment, abuse from different quarters, getting into bad habits. So it's nice that they're back in school and back into a structured environment.
Some people have expressed the fear that after the attention and the cameras have been taken away, there might be some slippages in terms of the compliance levels to COVID-19 protocols. After all, many of these schools, as you described them last week, are fair bubbles, as it were. So once you've gone in and it's a boarding system, most people outside don't get to see you again.
That is true, but don't forget that schools are the very place where discipline and consistency is being inculcated. So it's difficult to imagine that while teachers and educators are busy trying to instill those tenets of discipline and consistency in the students, they're going to allow slippage in something as important as this. These are places where you must get to class on time. You cannot run on the corridors. You must talk politely all the time. You can't raise your voice. You must do this. You must not do that. So it's very easy within a school setting to have that discipline, even when there are no cameras or people looking on.
Do you have any fear as to continued compliance by the students themselves with things like wearing of face masks? I mean, even for adults, this is fairly inconveniencing, if in some cases it's not uncomfortable. The question of hand washing regularly, 20 seconds at least, with soap and water and all of that. Those protocols, the social distancing, it's not all the time that the enforcers will be there. The students themselves sometimes must enforce this against each other.
Well, it's much easier to train up a child when he's young, because then when he's old, he will not depart from it. So I think the issue is that if you have to keep children in school, you've got to keep them wearing the proper school uniform, you've got to keep them disciplined and consistent to study and homework and whatnot and the other. It's quite easy to inculcate this. Yes, there will be slippages here and there, but these are also disciplinary points for the children. So if these secondary schools, if these schools are anything like the secondary school I went to, my goodness, there were certain things that even now when I do them, I'm thinking, oh my goodness, is the headmistress looking? So I think it'll be far easier to maintain this kind of discipline in a school setting than what we are seeing out on the streets, where there's been very little collective discipline, as it were.
We do not pray that we have any of these kinds of emergencies. But do you think the school authorities, the administrators are prepared just in case that they have to deal with an emergency situation of possible infections or even hoax cases?
Well, that is a difficulty, because this issue of school health and school emergencies is a recurring decimal. Let's be honest, schools, their core business activity is education. We're not trying to turn schools into emergency rooms or trauma centers. So there has to be some level of partnership between schools and, say, the nearest health center or facility. So schools must usually, and they usually do, to be honest, the good schools that is, have some kind of referral system, have some kind of procedures. They have a trained first aider. They've got first aiders in all at different levels, and they do know that they should have a school clinic or a sick bay, and they should know, at what point they will refer, who they refer to, and what kind of information goes to parents and guardians. These are already within the school protocols, most and generally. So adding one more layer to cope with this virus, it shouldn't be that difficult, and you will find that most schools, if not all, that are registered and licensed to practice as schools do have these protocols in place.
But this is a virus that keeps, what we know about it keeps changing virtually every day. Just today, it's been reported that the issue of how long it can survive on surfaces and what kind of surfaces and so on is again being reviewed. Now, do you think any of these changes may have some kind of impact on the capacity of people within closed environments, closed circuit, if you like, environments, like the kind of schools we're talking about? Could it have any effect on how they deal with this?
Luckily, we've set the threshold rather low in the sense that social distancing, hand washing, wearing of masks, constant sanitization of surfaces with the recommended products means that we're cutting the transmission of the virus to the very lowest. So adherence to these simple protocols, and they are really rather simple, should most and generally take care of most changes that we see, because we'd always known it was airborne. First we said it was droplet spray, now we say it's airborne, which means it remains in the room or in the environment a lot longer than we imagined. We always knew that surfaces, high-touch surfaces, were going to be a problem. If you have cleaned that high-touch surface regularly with the recommended products that contain sodium hypochlorite, it doesn't matter how long the virus can remain alive. If it can remain infective on that surface, if that surface is sanitized frequently and regularly, the virus doesn't stand a chance. Like I said, within a school setting, it's actually much easier to do than in a public setting, because schools most and generally are environments where discipline and consistency is the way of life.
Let me take you in a slightly different direction, even though it is somewhat related. And that is something we have discussed over and over again. Today, the Presidential Task Force did admit only 2 areas. Abuja has met it completely, 1% testing of its population. It says Lagos is close, but not quite there yet. But that apart from those 2 areas, no one else has met anything like getting close to the testing threshold. Does this surprise you that it seems that we're not making the effort?
I won't say we're not making the effort. Again, this is a reflection of the health system that we have outside the big cosmopolitan cities of Lagos and Abuja. I must admit, I am perhaps a little surprised at Port Harcourt, perhaps, but then again, maybe not. And it's very difficult in a disease like COVID, where what we have seen over the past, 7 months, has meant that a lot more people have remained asymptomatic than we expected. We just simply did not see the kind of morbidity, the kind of illness or fatalities that they saw elsewhere. And so it's very difficult to convince people who are otherwise well. They've woken up, they are all right. They are not having a fever, no pain anywhere, not even a tickle in the nose. Then you now say go for testing, and they know what the outcome might be. If they test positive, something has to be done. And if that's something that has to be done means they have to go into isolation for 14 days, somebody who needs to work every day to feed his family, that's simply not going to happen. So the alternative is that they don't even bother going to test at all. And you cannot convince them to just test for scientific purposes. It just doesn't make sense to them. They are well, they feel well, there's nothing wrong with them. And so this is a big problem that we're facing. I don't know how we're going to do it. I don't know why that bar should have been set. I think we should still have maintained the issue of those who feel ill should come forward for testing, because then you have something that you can say to them that, okay, you're not feeling well, let's do this test. However, what can I say?
Now, let me take you to something else. There's everybody seems to have forgotten that we're still on a phase of lockdown because virtually everything is reopening. But the PTF reminded everyone this evening that we are still at level 1 of the lockdown and that there is still another level to come. But there are those who say rather than go forward, we should actually be thinking about going back in view of what is happening everywhere else. And the PTF alluded to that today when they talked about what's happening in other places. You've also talked about it in the course of the evening, about what's going on elsewhere. There's no valid explanation as to why that hasn't happened here. Should we be more cautious? Should we be less cautious? What would you advise at this point that should be done?
I would advise we take a look at the realities on ground. We cannot do a cut and paste solution of what is happening elsewhere and then transport it into what is happening in Nigeria when we simply don't have the same situations. What is happening on ground? I mean, if we are to look at what is happening on ground, we have to look inwards and provide our own solutions. The truth of the matter is there are more people dying of the consequences of the pandemic on the economy than are dying from the pandemic itself. We can't continue. So looking backwards or looking forwards, the truth of the matter is we have to look at our own situational reality and apply the science to what we are seeing. If we are not seeing an excess of morbidity and certainly we are not seeing an excess of deaths, then we cannot say, oh, we are going into an increased phase of lockdown until other states can meet a 1% of the population testing. It doesn't make sense. Those states that are not meeting the 1% of the testing, are their health systems being overwhelmed by people sick with corona? No, they are not. But their economic system is going down. The people are suffering. The children are suffering from a lack of education. Parents can't pay school fees or rent. Other things are going on, and that has to be addressed.
I have one final question for you that I was thinking about your thoughts about this. Last week, I guess it came as no real surprise. We visited a community in Kwara State, and we're going to be visiting a couple of others in the days to come to see what's happening with COVID in purely rural settings. There was nothing, Doc. Absolutely nothing. So are we, again, hibernating another crisis?
We are certainly, we've been hibernating this crisis for many, many years. Ladi, you and I both know it. We've said it often and often. Where I know the work that the foundation I work with does in some of the not so rural areas, even in the Federal Capital Territory, no road networks for pregnant women to get to the hospital, no routine immunization, no primary healthcare centers for children to get routine immunization. I mean, we know we are incubating a huge problem and we are turning a blind eye to it and using the excuse of COVID, forgive me. But in some places, I'm seeing it as an excuse. Because we need to be addressing the realistic situations we have on ground. We know what we are facing with the security situations. And I just don't want there to be a problem. I mean, conflict resolution is as much a public health issue as is COVID or any other epidemic. So we know we know, and we've said it. Now the youth are out on the streets protesting police brutality, and people forget that this was a fight that started in 2018.
Indeed, Doc. Indeed, Doc. We will examine the issue of this COVID in rural areas in more depth the next time that you're here, because for me that is purely scary. It's really, really scary.
Thank you.
Yes, indeed. Thank you so much, Dr. Roberts, for your time this evening, and do continue to stay safe out there.
You too, Ladi. Thank you for having me.
Let's bring you the COVID caseload of over the last 24 hours. The total confirmed COVID-19 cases in its epicenter, Lagos State, passed the 20,000 mark last night after the NCDC reported 113 new cases in the state alone. There were 15,250 discharges. The active cases are 4,568, and the death toll is 204. Last night, other states like Kaduna, which had 21, Osun 8, Ondo 5, same with Oyo. Ogun had 3, Bayelsa 2, same with Taraba, while Edo, FCT, Katsina, and Plateau had 1 case each. They also recorded more cases, bringing the number altogether to 163 in 24 hours. 24 recoveries were made in 4 states and the FCT. Rivers had 15 of those, Kaduna 5, the FCT 2, Katsina 1, and Osun also had 1. The African continent continues to see recoveries, with more than 1.3 million people who have been discharged, while the death toll stands at over 38,000. Africa has confirmed over 1.5 million cases of COVID-19 since the crisis broke out. South Africa has recorded 83 more COVID-related deaths in the last 24 hours, as the recovery rate still stands at 90%. while the country faces an uphill task trying to rebuild the economy, which was already in recession pre-COVID-19, a string of disputes, mostly labor-related, continues to make headlines. The health minister, Dr. Zweli Mkhize, has warned that while a second wave of the COVID epidemic in the country is not yet visible, chances still exist if people do not act responsibly. So let's talk to South Africa Bureau Chief Betty Dibia. She joins us from that nation's commercial capital to give us more on this. Hi, Betty. Nice to see you.
Same here, Ladi. How are you?
I'm fine and trust you're good too. Let's start with Dr. Zweli Mkhize's comment that while a second wave of the COVID epidemic in the country is not yet visible, chances still exist if people do not act responsibly. What exactly was he referring to?
Well, that says it all. He was speaking to local media when they asked, because one of the scientists had said, look, it's still possible to have a second wave. We had lower figures, relatively lower figures, below 1,000 per day or less than 10,000, in a week. But in the past few days, we recorded, like on Saturday, we recorded 2,364. Sunday, we had 1,500 plus. So he was being asked, oh, are we going to that direction? And he says, for now, we can't see because we've come from where we were getting over 70,000 in a week to about 10,000 in a week. That's 1.5, 1.8 daily, so or less. So that's just what he's saying. He's saying he's happy for now, and that recovery rate is still around 90%. It hasn't gone lower. So there's still hope. But people need, it says it all. People need to obey the health safety regulations in order to keep the higher figures at bay. So today we had 888 new confirmed cases, bringing the total to almost 693.3 thousand confirmed cases in the country, and recovery rate is still, as I said earlier, at 90%, with 624.6 thousand recoveries. So the death toll with the 83 new cases or new deaths recorded, it's at 17,863. So he's just saying, let's keep it slow of any increase, although the country is prepared hospital-wise or facility-wise to take care of any new wave. But it's better we keep the high figures at bay by being responsible.
The other thing, of course, is that this is happening at the same time as the economy is on shaky grounds. And yet there are labor disputes. Virtually every sector wants something or the other from the government. If it's not COVID allowances, they want some kind of preferment or the other. How is that developing, do you think?
Oh, we're having more and more from different sectors. We have the How train, which has entered the second week. The high-speed train that is, I think, is just in Gauteng at the moment, which was launched during the World Cup in 2010. That has it's reduced services, and they're demanding an 8% wage increase. We have the veterans of the Mkhonto Wesizwe, the militant arm of the ANC, talking about the transport sector, the foreign nationals being employed in the trucking sector of the transport industry, and then the transport minister going full out on Twitter, having a really bad exchange with some of the MK veterans. So these are some of the things. You have the mining communities, you have even the e-hailing services. Of course, you have COSATU and their friends who are still waiting to hear what government has to say regarding what I think the 5.6% wage hike that they're waiting for. So government is dealing with all that. Next week, I think we expect a supplementary budget, and the minister, Mr. Tito Mboweni, he's not saying very pleasant things, and no one is expecting pleasant things to come, but he's saying people need to get responsible and not expect anything good.
This statement about getting responsible, you're hearing it there, we're also hearing it here. Thank you very much, Betty. Do continue to stay safe out there.
You too. Thank you so much.
United Kingdom Prime Minister Boris Johnson today explained why he will not be announcing a second national lockdown for the United Kingdom, saying he does not believe it would be the right course and citing damage to the economy and to children who would miss out on school. His thoughts were deeply criticized by Labour Minister Keir Starmer, who expressed his thoughts to other members of Parliament today. This comes as the number of COVID-19 cases around the globe continues to rise.
I call the Prime Minister to make a statement. Prime Minister Johnson.
The UK Prime Minister Boris Johnson, while dismissing a second national lockdown, confirmed that most areas already subject to local restrictions on top of the national rules will automatically move into the high alert category, that is Tier 2. He said the very high alert level will apply where transmission rates are rising most rapidly and where the NHS could soon be under unbearable pressure without further restrictions. Over in France, the Paris region is a race against time to contain COVID-19 cases, according to the health official responsible for the capital and its suburbs, adding that authorities are preparing for every scenario as the number of cases continue to climb. The number of new coronavirus infections in France was 16,101 in the 24 hours of Sunday evening, down from a record of almost 27,000 the previous day. It took the figures to a cumulative total of 734,974 since the start of the year. In Italy, 4 members of the Vatican Swiss Guards, the elite and colourfully dressed corps that protects the Pope, have tested positive for COVID-19. The results came in over the weekend and added to 3 other residents or citizens of the tiny Vatican city-state who have tested positive. Residents of Madrid have continued their protest against a partial lockdown to contain one of Europe's worst coronavirus outbreaks as they took to the streets waving national flags during National Day. The protests, however, escalated to a standoff between Socialist Prime Minister Pedro Sanchez and the Conservative-led Madrid regional government, on which Vox holds 12 of 132 seats and which argues that the government's curbs are illegal and excessive and will spell disaster for the local economy.
That's our COVID-19 update for tonight. Thanks very much for watching. Do continue to observe the COVID-19 protocols. For details of those and how you can have other ways to stay safe, please go to our website at channelstv.com. There you find the details of that and indeed other stories on COVID-19, plus stories on other topics as well, business, sports, of course, politics, both nationally and internationally. channelstv.com. I'm Ladi Akiridoluale. Do have a pleasant evening. Good night.